Today we are going to discuss respiratory irritants and COPD or asthma exacerbations. So as far as the irritants go, which is what we're going to cover the most, everybody has irritants that are specific to them. Everybody reacts differently to different environmental exposures. So we're going to just briefly cover some of them, the most common ones. And you received a handout that looks like this that does go over all of the most common ones. There is a place to put a solution. So you can go through them, check mark which ones are for you or apply to you, and then try to come up with a solution on how you can manage that. If you are unable to come up with a solution, you're welcome to bring this handout back with you, and staff or myself can go over that with you and try to help come up with a solution for you or brainstorm an idea. So the very top one is going to be smoking or secondhand smoke. They have discovered secondhand smoke is just as dangerous as firsthand smoke. So you want to make sure to avoid that as much as possible. If you do smoke, you want to try to quit. I know that's easier said than done because smoking and nicotine are very addictive. So please reach out to your doctor, reach out to us if you need help with any of that. We have plenty of resources and information to help you with that. And if you are trying to quit, don't give up. It takes most patients 10 to 15 tries to actually quit smoking. Wood fire or wood smoke and fires. This is going to be really common for us in the Northwest with the summer. We tend to get a lot more fires. So making sure that we're covering any leaks, anything that can come in from outside, trying to stay indoors as much as possible. Wearing a mask if possible when you go outside to limit your exposure while you're out there. Any of those areas, and then make sure you're in well-ventilated areas if you do have a wood fireplace. And that goes in with the air pollution. There's a website on here called airnow.gov. You can download an app and you can look at it. It will give you that day's expected forecast for the air quality, and then it usually gives you the next days as well for your area. Or you can look ahead if you plan on traveling somewhere and see what the air quality there is going to be, which just helps you to plan out your trip or your day regarding how the air quality should be throughout the day. On the next page is dust and dust mites. So just kind of paying attention, making sure you're dusting. Big thing to help with this is going to be an air purifier in your home, and make sure you're changing out the filter regularly. That will help reduce the amount of dust in your home and any exposures you may have to that. Cockroaches is on this list. Not a big issue where we live, but if you do have that issue, kind of looking through this, paying attention to that and trying to get rid of those, as those do affect our respiratory system. Pets and animal dander. For this, I highly recommend patients, if you have pets, I'm not going to tell you to get rid of them because those are very important to have for your emotional health, and just in general, I would never tell you to get rid of your pet. It is important, though, to pay attention to your grooming. So if you can, groom them outside with a mask on, so you're not breathing in any of the things that you're grooming off of them, and so that all the hair that you're grooming off of them can go out into the world and not into your home. Or you can take them in and get them professionally groomed if that's something that you can afford to do. A lot of animals, depending on the breed, will have an undercoat, which starts to shed in the spring and then also in the fall. They tend to shed the most. So getting them in and what's called de-shed, where they're going to go in and take that undercoat out, that can definitely help reduce the amount of shedding in your home and those irritants that you may have from that. Again, an air purifier in your home with animals is also going to help with those. Mold and mildew. So mold and mildew can be a big issue up in the Northwest because we do have a lot of moisture in our air. So paying attention to your furniture specifically. You don't want anything pressed up directly against a wall because that's where mold and mildew like to grow. So they like dark, cold, damp places, which when you have furniture directly against a wall, that definitely creates that. If you have furniture directly against your wall, make sure you're pulling it out, take a look behind there, and then just leave a couple inches away from the wall so that it's well ventilated so mold and mildew can't grow in that area. And then if you have any mold in your home that you've been trying to get rid of, you've been bleaching it, it's not going away, black mold is an issue in our area. So definitely calling in a professional, having them test for black mold. You cannot kill black mold off. You have to completely remove that portion of the wall and completely cut out all of the drywall and everything that has black mold on it to get rid of it. So you cannot just kill it off with bleach. So you would definitely need a professional to come in and do that. And then black mold is very harmful to our respiratory system. So if that is something in your home, you definitely want to get that corrected as soon as possible. And then pollen affects everybody. If you can tolerate it, wearing a face covering so you're not breathing that in if it's cool enough outside, or making sure you're taking your inhaler 20 minutes before you go outside. If you have a lot of pollen, again, keeping your windows closed, an air purifier in your home, making sure there's no air leaks that pollen can get into your home. And then also paying attention to the times of day that you're going to go outside. If it's super windy and stuff where it's going to blow up that pollen, you're going to want to try to avoid that as much as possible. And then taking your allergy medication consistently. If you know you have allergies, seasonal allergies, start taking your medication a couple weeks before that becomes an issue for you, because it does take a while for that to build up in your system and actually take full effect. So you want to be more proactive with that versus reactive if you have seasonal allergies. And then strong odors. So hairspray, clothing, fabric softeners, body washes, colognes, perfumes. This is why we ask people not to wear those things to class, because that can be very reactive to certain people's airways. If you're noticing you're having a much harder time breathing and you just recently changed any of those things, it could be that specifically. So try to switch and see if that helps, especially with your laundry detergent, fabric softeners, your fabric softening sheets. All of those can have a big impact on our respiratory system without us really realizing it. Respiratory infections. So every time you get sick, as a pulmonary patient, it's going to have a permanent effect on your respiratory system. So there will be permanent damage to your lung function. So a permanent decline. So we definitely want to avoid getting sick as much as possible. So washing your hands frequently. Don't touch your faces as much as you can avoid it. Staying away from anybody who is sick. And this is something that I'm going to push. This will probably be the hardest thing I ever push, but you need to set that boundary with family. So even if they have the sniffles, even if they think it's allergies, they cannot come over. And the reason for that is the sniffles for me, if it's not allergies and I just assume it is, and maybe I just have a common cold, that could lead to hospitalization for you. I have had patients that have passed away because family members came over with the sniffles, and they got extremely sick from that. So that needs to be a firm line set with family to make sure that nobody's coming over when they're sick, to make sure that you don't get any illnesses. Wearing a face mask out in public. So even prior to COVID, I recommended patients used face masks out in public during the cold and flu season to help reduce exposure to anything in the air. And then getting your flu shot and your pneumonia vaccine. Flu shot should be once a year. Pneumonia vaccine is usually just once. And discussing that with your physician as well to make sure that is appropriate for you. Physical exercise. So exercise is going to help with your breathing. It's also going to help reduce inflammation, but it can cause a trigger for some people. Sometimes that does cause constriction. So make sure you're not exercising out in cold weather or hot weather. So anything below 45 or above 85, those are considered extreme weather temperatures. Do a warm up and a cool down to help with that. And then using your inhaler beforehand. If you have one, you can pre-treat with that and be proactive. So if you have an albuterol rescue puffer, 20 minutes before you exercise, you can use that to help. Again, discussing that with your doctor to see if that is appropriate for you. And then strong emotions. So stress, crying, even laughing a lot can cause some shortness of breath. I won't tell you that you can't laugh. A good joke is always very beneficial for everybody. They say laughter is the best medicine. So definitely laugh, just trying to be mindful that you might need to stop and catch your breath a little bit more often, because that will affect that. Same with crying is going to cause you to be more short of breath. Stress and depression cause more shortness of breath, anxiety, all of those. So definitely getting relaxation techniques, taking a break as needed, any additional support that you may need from us or from your doctor as far as those strong emotions go. And then extreme cold or extreme heat. When you're out in the cold weather, again, wearing a face covering, because our body does not like cold air. It's very shocking to our system, to our heart and lungs. It doesn't like that when you breathe in really cold air. So wearing a face covering is going to help limit how much cold air you're breathing in. The same reason it works in the wintertime is the same reason it sucks to exercise with them on, because they trap in heat and moisture, and you breathe that, which is going to help when you're out in the cold weather. When you're not in cold weather, it can make it a little bit harder to breathe. And then same in hot air. A mask isn't going to help with when it's hot outside, but trying to avoid heat as much as you can, staying as cool as you can, indoors in cool weather or cool air as much as you can during those times. Now we're going to talk really quickly about exacerbations. So there is this handout. This is going to talk about, kind of talks about what an exacerbation is and how many people have COPD. So approximately 16 million people in the United States have COPD, and there's been a big push on finding the millions, because millions of those people do not know they have COPD or have been undiagnosed. COPD is the 4th leading cause of death in the United States. And so it is very prevalent, and it is very important to get it treated, get on the proper medications, and get it under control as soon as possible. An exacerbation essentially is a flare-up of your disease. So usually it comes from an infection of some kind, or illness will cause a flare-up. Generally, you're going to need to be on certain medications. That is where this can come into place. So this is an action plan. If you want this handout, let us know. And it just discusses if you're having a good day, a not so good day, or a really bad day. You can set that with your doctor so that you have a plan in place on how to respond to those situations, which can help relieve your anxiety surrounding that, which will help with your breathing. And then stop smoking. Exercising regularly is going to help. Speaking to your doctor, taking your medications as needed. On the back of this handout, it does talk about like what you can ask your doctor, treatment options, other conditions, things that can be impacted. With this handout, so green days are just your normal baseline. Yellow days means that you're not doing great. Something has shifted. You're having more shortness of breath, and you need to usually start on a new medication or something to be proactive. And then a red day is you're going to the hospital. With these, you definitely want to call 911 to go in, because they have all the treatments and oxygen on board that you may need. And then I also recommend everybody has an emergency file that has an advance directive, if you have one, in it, a list of your medications that you're taking, and a list of your medical history written down. So that way, if you are going to the emergency room when you're that short of breath and they're asking you a million questions, you can hand them the file. So you only have to answer questions about that specific event or what led up to this exacerbation, not your whole history when you're already feeling so short of breath. And then lastly, there's a handout on the air quality, Washington air quality. So it talks about the different groups, who falls into what group, and how to manage those groups and what you should be doing if the air quality is in that category. If you want any of the additional handouts beyond that irritants one, just let us know. And if you have any questions, let us know. Have a good day.